Hi, my name's Elizabeth and I'm a licensed practical nurse.
Hi, my name's Elysa and I'm a young parent. And in this video, we'll be talking about preventing another pregnancy and also preventing sexually transmitted infections, also known as STIs.
Your sexual well-being is part of overall health. So this includes safety, communication with your sex partners, exploring your sexuality, consent, prevention of disease, mental wellness, and more. Two of the components of your sexual well-being is to prevent sexually transmitted infections, also known as STIs, and preventing pregnancies. So what are some of your top questions regarding STIs and pregnancies?
So what's the best way to protect myself from getting an STI?
So abstinence is the best way to prevent an STI or a pregnancy. And I know abstinence is hard, but be sure to use other types of birth control methods. If you are sexually active, then some ways to lower your risk for STIs are to limit the number of sexual partners that you have, to use a new male condom, a female condom, or a dental dam during every sex act. You need to get tested for STIs regularly so that you know your status and get treatment if you do have a STI. It is also important to have open communication with your partner and to also get tested together so that you know your status.
That is great information. Male condoms are easy to find and they're usually not expensive. But where can I find female condoms and dental dams?
You're right. Male condoms are pretty easy to find and they're very cost effective. You can also get them from your local health department for free, your doctor's office, and some insurance plans or Medicaid will even pay for them. And they are also available in many stores.
Where are some places that I can get tested for STIs?
So you can get free or low-cost testing at your local health department or even your doctor's office. Many health insurance plans and Medicaid will also pay for these.
So how often should somebody get tested for STIs?
So ideally you should get tested after each new partner, or if you don't use some type of a barrier method such as a condom. So ideally you should be tested once a year if you have multiple partners, or every other year if you do not have any new partners. And this is just to be safe because it does take some time for some STIs to show up positive. So for example, HIV can take up to 6 months for it to actually show up on a test.
I didn't know that. Thank you for all the great information. Right now, I'm so focused on my son, school, and work, so I'm gonna be abstinent. When I start to have sex again, what's the best way to prevent from another pregnancy?
There are a lot of options for birth control. It's all about what options are easiest for you. We can talk about some of the options of birth control. Which type of birth control would you like to talk about first?
Can we talk about LARCs? I hear a lot of people talking about them.
Some of the most effective and low maintenance options are LARCs, also known as long-acting reversible contraception. So LARCs include IUDs like Mirena and Paragard that are placed in the uterus and implants like Implanon and Nexplanon that are placed in the arm. These devices can stay in place for between 3 to 5 years and are 99% effective in preventing pregnancy.
I like the idea of something long-lasting, so I don't have to worry about it for a while. What are some of my other options?
So another option of birth control is a patch, and you would be able to wear them on certain parts of your body, but it's very important that you need to change them once a week. There are 2 patches that are actually approved here in the U.S. There's Twirla and there's Xulane. It's important to remember to change your patch according to the schedule. If it's used correctly, it is 93% effective in preventing pregnancy.
The patch sounds like it's pretty easy to use. Can we talk about the ring?
So yes, as you mentioned, there is a birth control ring. It is a small flexible ring that you put into your vagina and you take it out according to your menstrual cycle. There are 2 types of rings available. There's NuvaRing and Anavera. NuvaRing is good for up to 5 weeks. Anavera is good for up to a year or 13 menstrual cycles. When used correctly, the ring can be 93% effective at preventing pregnancy.
Thank you. So far we talked about the birth control that you wear and the kind that's inserted into your body. What about the shot?
Some people do prefer the birth control shot. The birth control shot, or the depot shot, is an injection of birth control medication that you get every 3 months. A good benefit of this shot is you only have to get it 4 times a year. But it's very important that you keep your appointments with your doctor to make sure that it is effective. When used correctly, the depot shot is 96% effective in preventing pregnancy.
I like that with the shot, you don't have a device you have to wear or insert. What about the pill? Can you tell me more about that?
Sure, birth control pills come in a package and you take 1 a day. You must take it the same time every day in order for it to be effective. There are 2 types of birth control pills. First, there's a combination pill, which is estrogen and progesterone, and then second is just the progesterone. When used correctly, it is 93% effective in preventing pregnancy.
Can we talk about the withdrawal method? I hear a lot of people talking about that.
Of course, the withdrawal or the pull-out method is when the male takes his penis out of the vagina before he ejaculates. The basics of the pull-out method is to keep sperm out of the vagina. In order for this to happen, the male must remove his penis and not get any sperm anywhere around the female's genitals. This can be difficult to accomplish because it does take skill and dedication. Therefore, this method is not very effective and should not be relied on as a primary use of birth control.
Do any birth control methods protect against STIs?
Condoms are the only birth control option that can be used to prevent both STIs and pregnancies. When using condoms as your only form of birth control, it is important that you use a new condom for each new sex act and that you use it properly. Male condoms are placed on the penis and female condoms are placed inside the vagina before sexual intercourse starts. They collect the semen so it isn't able to reach and fertilize the egg. When used properly, condoms can be 87% effective at preventing pregnancy. Because condoms also prevent STIs by limited skin-to-skin contact during sexual activity, it's best to use a new condom every time that you have sex, especially with a new partner. In fact, it is recommended that you use a dual form of birth control, so you would need to use the condom in either a pill or a patch or some of the other options that we discussed earlier.
What about Plan B as a backup method?
Plan B, or the morning after pill, is an emergency contraceptive that you can use if you did not use other forms of birth control. Plan B is usually available without a prescription and is known under several brand names. You can take it up to 5 days after unprotected sex, but the sooner you take it, the more effective it can be. It can be between 75 to 89% effective in preventing pregnancy. It is also important to note that if you are more than 165 pounds, Plan B may not be effective. It also is not effective if you're already pregnant.
Thank you so much for all this great information. Now that I know about all the different types of birth control, I can now choose the one that's best for me and fits my life.
I'm so glad we had a chance to talk about preventing STIs and methods of birth control. I hope this helps you choose the right method for you. And if you try one method and you don't feel like it's right for you, you can always try another method. It's also great to talk to your doctor or your nurse about other options that are available to you. Website links with more information will be provided at the end of this video.